A year ago, Latoya Rudolph learned about HealthReach from a friend. Her experience changed not only her physical well-being, but her outlook.
It's been amazing. Me and Dr. Granillo have a special bond, I feel.
She was struggling with some physical ailments, and then she was also struggling with some financial ones, which most people are when they come here.
Latoya's story is all too common. Here in Iredell County, 1 in 8 working-age adults does not have health insurance, and the average annual household income among patients, less than $15,000. Finding HealthReach means finding care that's often been sorely neglected.
They come in and they haven't seen a provider in years, or they were being followed by someone else and then they lost their insurance. So they have a bag full of diagnoses that need to be managed.
With the help of the community, HealthReach has been able to provide services at no cost to patients for more than 2 decades, and the one constant, an ever-growing need. Just last year, HealthReach saw more than $675,000 in high-quality medical services provided to people like Latoya.
To me, it's not like a doctor's office. We sit, we talk, we laugh. I get personal, so she sits there and listens to me. I vent a lot. I cry. And she does not judge me, gives me great advice. I would not change her for the world. I wish I can keep her for the rest of my life.
And then there was 2020. Beginning in March of that year, HealthReach faced what was by far its greatest challenge to date. The pandemic led to the sudden loss of key volunteers, supply chain shortages, and cancellation of the clinic's annual fundraising event. Patients with symptoms began knocking on the clinic's door long before HealthReach was able to amass PPE or offer COVID testing, all while patients with diabetes, heart disease, emphysema, and other conditions continued to need care. Instead of lingering in the unknown, HealthReach team members faced it head-on, pivoting on a dime. They created a new curbside pharmacy service, offered telehealth as a supplement to in-office medical appointments, designed a fully outfitted sick room to safely treat COVID patients, and provided literally hundreds of supplies from thermometers and pulse oximeters to blood pressure cuffs and nebulizers to empower patients to monitor and manage their own health from the safety of their homes. HealthReach became one of the first clinics in the area to offer free COVID testing and COVID vaccines. Remarkably, most of the professionals providing these services did so as volunteers, including the entire team of HealthReach nurses. They risked their own health and safety and that of their families to ensure that our most vulnerable neighbors would have the medical care and medications they needed. In the midst of the pandemic, in 2021, HealthReach provided nearly 4,200 medical appointments and dispensed more than 10,500 prescriptions to uninsured patients. In a time when healthcare services were least accessible but most needed, this organization stood strong. But coming out of it has also been a challenge.
When we got back into the office, we were just seeing people who were sick, or they were coming in because they had had parents or friends or brothers and sisters die of COVID. And so mental health was a big issue for them. Or because of COVID, they had lost a job, or their hypertension had gotten worse, or they didn't have any access to get healthy foods, so their diabetes got worse.
HealthReach has experienced record growth in the number of new patients applying for health care, and the demand for mental health services has exceeded all expectations. Between 2019 and 2021, the number of mental health consultations provided at HealthReach more than tripled. But none of this great work can happen without the financial and volunteer support of the community.
We exist and are able to function because of the generosity of so many people who volunteer their time, volunteer their expertise. We can't continue providing the great care that we do without the generosity of our neighbors, of our local individuals who see that we do have a need and understand that they absolutely can play a part in helping us do this work.
Donations of cash and supplies are needed now more than ever. Medical professionals are needed to see patients at HealthReach and in their own offices. But consider the investment. For every $1 invested in HealthReach, more than $10 in goods and services is provided to patients with limited means and no health insurance. 10 times the return on investment. It is by far one of the most effective ways of reducing healthcare costs for all of us by reducing emergency room visits and providing prescriptions through the HealthReach pharmacy. And the impact on lives is immeasurable.
Yeah, I feel like this is the best doctor's office I've ever been to in my entire life. Hands down.
That means the world to me, is that she keeps coming back because she knows that we're trying to help and that we are helping and that we're getting her where she needs to be.